we're looking at a health service that has 47,000 nurses missing, about 10,000 doctors in secondary care. We have, missing. We've got 1,000 fewer GPs than we had when they first made the target to increase our GP numbers by 6,000. We've got a growing patient load. We know that that impacts the care that we can provide. And at the same time, as we've had a pandemic, we've had massive inflation, we've had a real terms pay cut of over a quarter for junior doctors, over a third for consultants, and nurses facing similar. So, of course, we have to take action in that circumstance, because we're not happy with either the squeeze on our living standards that we've been forced to endure, nor with the impact that that's having on the care that we're able to provide.
Would you like to see coordinated action amongst the health service unions? We know that the nurses are planning to go on strike, I think, on the 15th of December. When I was speaking to Unison yesterday, their leader suggesting that potentially ambulance drivers could coordinate with nurses. Is that something that you support?
Certainly, we'll be having those conversations. Junior doctors are balloting on the 9th of January. So it will be a while before doctors are joining in a coordinated action. But there are two reasons to coordinate. The first in the health service is to make sure that patients are safe. We obviously work as a team across the health service. So if we don't coordinate and discuss amongst ourselves how we're going to cover urgent, emergency and critical care, then we will have problems. So we do need to do some degree of coordination. And the second reason is that we want there to be an impact on the employers and on the government to bring them to the table to negotiate with us. If we coordinate and if we're effective, the government and employers will negotiate faster, and that's better for us and better for patients in the long term. So coordination is not bad news for patients or the public. Coordination is good news for patients and the public, as well as for us as unions and staff in the health service.
Okay.